Drew McPhail here, McPhail Chiropractic Pain Relief Clinic in Somerville. Thank you for coming to my site and watching my blog. Today I want to talk to you about a little something that's really not well known, and it has to do with the relationship of back pain or chronic pain and your ability to think and cognitive functions, cognitive capabilities. There's a lot of research out there that shows that motion actually facilitates brain function. Now, we think of it this way: our brain controls the function of every physiological process in our body, but it actually requires information to facilitate its function, and this majority of this information is called proprioception. Now, in our joints we have these nerve receptors. We have these nerves that tell our brain where we are in space. All right, what they do is they detect motion as well. So whenever we're walking along, we raise our arms. Anytime we do that, we're facilitating brain function. Now, what happens is when people have chronic pain, okay, one, if you're in pain, you're unable to exercise. All right, and by doing that, right there, things are breaking down. Number two, when you have these degenerative conditions, when you have degenerative disc disease, or if you have arthritis of the spine, or if you have arthritis of your knees, okay, when we have these types of degenerative conditions, it prevents range of motion. Okay, and the way that we facilitate those nerves that turn our brain on is through motion. So say you have been diagnosed with degenerative disc disease, and you have less range of motion than a normal person does. So every time you turn, you're limited by 15%. Well, that means your brain is getting 15% less stimulation than it normally would. Okay, and this is how it relates to that. If you think about it, as we age, or in our elder population, okay, a majority of them have degenerative disc disease. They have arthritis of the spine. Okay, they're very sedentary. And there's a lot of things out there that says do word puzzles, do things that make your brain function, but the fact of the matter is you need to exercise and you need to get that motion. That's what facilitates and turns the brain on and stimulates it. Now, if you have something like sciatica, okay, which is actually a compressive neuropathy, what happens with sciatica is the nerves that exit the lower back, they come together to form this fat nerve that runs down the back of your leg and goes all the way down to your toe. Well, when you have sciatica, that's an indication that there's compression of those nerves. And what that causes, it's a thing called deafferentation. What it does is it prevents the normal signaling of those nerves to the brain. So guess what's happening? The brain begins to break down even faster than it should. Okay? Common signs of a decreased function would be brain fog, or you walk into a room and you can't remember why you went there. You walk up to a person and you know them, but you can't pull that name up really quickly. These are just all indications that you might not be functioning at that optimal level. So if you suffer from back pain, if you suffer from neck pain, you have sciatica or any other types of disabling arthritis type conditions, please give us a call. There's a lot more to it than just the pain. It affects every physiological function in your body. So take care of yourself. Thank you for coming to my site. Give us a call at 843-873-2225 or visit us on our website at McPhailClinic.com. You can request an appointment right there. Thank you again for watching, and here's to your health.